at 11. It may be a controversial topic, but many parents have lobbied for it. We are talking about medical marijuana used to treat children with severe seizures.
Georgia Governor Nathan Deal announced Tuesday his plans to push for clinical drug trials, and one of those will be right here in Savannah. WJCL's Ashley Lincoln has been going through the information this evening and joins us now with what she's uncovered.
Yeah, Kevin and Jennifer, the doctors you're about to hear from say this is great news for medical research, especially in a state where the sale of medical marijuana was not approved earlier this year. Well, many parents who have lobbied for a change as of yesterday, they just might get it.
Neurological evaluation of rhabdomyolysis.
Neurologist Michael Hemphill, an expert in the industry with over 40 years, has seen the toll epileptic disorders can have on a family with a young child.
They're having frequent seizures several days per week. Often the family really can't go anywhere, can't make plans, so their parents are desperate. And if there's any glimmer of hope for something that might help, then they're going to go to bat for their child.
And that glimmer of hope came Tuesday when Governor Nathan Deal announced his push for clinical drug trials on medical marijuana to treat severe seizure disorders in young children in the state of Georgia.
I was actually up in Augusta on Monday for the meeting to plan the trials.
Dr. Eric Perlman is part of the team that will be conducting the trials here in Savannah.
The beauty of what the governor is doing is he's saying, well, let's do this in a scientific way. And really study this to know if it really is beneficial.
The trial will test a deconstructed form of the drug. It's called cannabidiol, or known as CBD.
So this is not a trial of, any herb or plant. It is a chemical that the plant makes.
The cannabidiol will treat patients having two different forms of epilepsy, Dravet and Lennox-Gastaut.
Both of them cause severe refractory seizures in children, and they're associated with neurodevelopmental problems.
But both doctors say even though this isn't necessarily a cure, it's a step in the right direction.
I think it's a great step forward for medicine. I think it's a great step forward for Georgia.
I'm strongly in favor of a good scientific study done through appropriate channels.
And they expect to start the drug trial by the end of the year, and once they're ready to start, they'll be able to have families apply for those positions in the trial if they want to be a part of it. Kevin and Jennifer.
Interesting. All right. Thanks, Ashley.